Well, then he goes.
Morrison County Board of Commissioners come to order. Please stand and join us in saying the Pledge of Allegiance. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Morning, everybody.
Morning, Mr. Chair.
Approval of the County Board minutes.
So moved.
Second.
Motion made by Commissioner Winter, second by Commissioner Wilson to approve the minutes. Any discussion? All in favor?
Aye.
Opposed? Motion carries. Additions or deletions?
Not at this time.
Gentlemen,
Motion.
motion made by Commissioner Jelinski,
Second.
second by Commissioner Wilson. Any discussion? All in favor?
Aye.
Opposed? Motion carried. Next on the agenda, years of service ceremony. Deb?
All right, I'm going to have you join me down here, though. It's always one of my favorite days because I think this highlights in county government how diverse we are. It takes everybody, a wide variety of people in the work that they do to make us successful every day, so thanks for coming. And it's nice to visit a little bit and recognize those that have been here a while and make the work possible and you dedicate it. It's not easy work that we do, regardless if you're plowing roads or if you're arresting people or keeping them safe in jail or selling driver's license. That we know has been busy to everything that we do, helping kids, helping the elderly. So thank you for that, and thanks for being here so we can say thank you more formally. So I appreciate it. So we'll start this morning with 5-year certificates. And employees were given a choice between chamber bucks or some Morrison County garments to celebrate their dedication. So I appreciate it. Ashley Effinger. Congratulations. Yes, it is fun, isn't it? Yes, it's what we get to do every Tuesday. You can come back next week.
All right, thank you so much.
Bruce Rexstad. Thank you.
Thanks, Bruce.
Cindy Nienaber. Thanks, Cindy. Dana Oman. Thank you, Dana. Erica Peterson. Didn't see her here. Jennifer Koenig. Thank you, Jen. Jordan Doroff. Oh, sorry. Thank you, Jordan.
Thanks, Jordan.
Thank you, you bet.
Jordan Geisey. I didn't see him here. Kara Kicker. I saw Kara. Thank you, ma'am. Kathy Marshik. Let's see Kathy come down this morning. Maggie Peterson. Thank you, Maggie. Rena Ersfeld. Let's see Rena come down. Sarah Gilson, I saw. Thank you, Sarah.
Thank you, sir.
Sarah Call, she's out. Sarah Morcombe, I believe, is out also. And Mike Wilson. Got to turn around, watch my back on this one. Thank you, Mike. Congratulations to those that have been here 5 years. We have one recipient, and that's Amy Brill, and I don't think she's here this morning. What was that? Mexico. Well, I'd rather be in Mexico. I'm not going to lie there. But 15 years, Mr. Yoder, Elvin. Congratulations. Thank you. Congratulations. Cindy Bachin, congratulations. Thank you. Thanks, Cindy. Jared Wahersky. Thanks, Jared. Nice haircut. We already established that. Yep. Oops. Jody Winsenberg. Oh, for goodness sakes, Mike, I'm a mess here. Here's Jody's. That's just me dropping that. Thanks, Jody. Mike Chisholm. I didn't see Mike this morning. He's upstairs in the county attorney's office. Rick Madison, I don't think is here either this morning. He's a deputy. And Judy Liddell, I saw. Thank you, Judy. Our 15-year recipients, congratulations. All right, 20 years. Goes by fast, doesn't it, Denise Vogel? Thank you. Congrats. Sharon Peterson. I didn't think I saw her sneak in. She's up in Land Services. Mr. Larson, Sean Larson. Congratulations. 20 years. Congratulations. $25. Doug Rexted. My goodness. Congrats, Doug. Thanks. Jeremy Luberts. Congratulations. Thank you. Oh. Yep. The armless chairs are important. Congrats, Jeremy. Melanie Erickson. I didn't see Melanie this morning. 25 years. Thank you, folks. 30 years. Can you believe it? Donna Schultz. Congratulations. Thank you. Thanks, Donna. Jennifer Drill. Thank you, Jen. Congratulations. Jody Luckin. Thank you, Jody. Congratulations. Renee Wenner. Thank you, Renee. Congratulations. 30 years. 35 years. Amazing, isn't it, how time flies? Gloria Austin. I don't think she's here. She's with Extension. Lynette Gassel. Congratulations. Thanks, Lynette. Trish Bode. 35 years. Congratulations. Thank you. Scott McKissick. Congratulations. Thank you, Scott. And last but not least, Mr. Steve Bukowski. Nice job. Thank you.
Thank you.
35 years. Like I said, it never ceases to amaze me, all the good work that's done here every day, and thanks for being dedicated to jobs that just aren't easy all the time. And so we appreciate you being here this morning. We're going to take a couple photos because everybody loves that. So we can get that publicized so people know what good work you do, not just us. So we'll start with probably, what do you think, guys? Let's do the 5 years, and then we'll do maybe 15, 20, 25, and then the 30 and 35 together. So 5 years, if you want to come up and gather around the board, and we'll say, yeah, I think so. I'm going to shut this off.
This one's gonna be spread out.
Tabitha?
Good to sit in the middle, isn't it?
Yeah.
Thank you.
Thank you, guys.
Good morning, dear. Please behind us here.
Yep.
On in. Yep.
Yes, you may.
Plenty of room.
Try. I'll do my best.
Very nice.
I won't focus. Ready? Smile.
One more. Looking good. Thank you.
Thank you.
Thank you very much.
Good day.
Thank you.
We'll see you another 5.
Surprised to what?
you find Hanson and Fraser today?
Working. They're all over at work.
You'd think she would be. Oh, how you doing?
Congratulations. Yeah, right on the money. Old guys go in the back.
Do you guys feel protected? Because I'd feel
No
scared.
problem. They probably won't see you.
I'm gonna have Jeremy move it. Yep. I'm gonna wait. She'll go first. That we don't get cross-eyed and in the wrong place. Perfect. It couldn't be better. Honestly. Thank you.
Thank you.
You guys are professionals.
Thank you.
Mug shots.
Thanks, Al.
We'll see you all in another 5 years.
Good job.
Absolutely.
Which ones are these? These are 30, 35. This is the rest of us.
This must be 25 years.
Aye.
30.
I love it.
But you gotta all the way down.
Only time.
Keep going, keep
Steve,
going.
why don't you go on the other side? And we'll balance that out a little.
Okay, so which way you want us?
He's coming around. You're good. Perfect. Yes.
That, I felt that,
Hold
I
on one
felt
second.
that. God darn it.
I don't care. It's fine. Smile. My goodness, the years of experience, huh? You feel that board behind you?
Getting older already, just sitting here.
Oh. Thank you.
You're awesome, thank you.
Thank you.
Don't tell me you touched it. Did you didn't stick it in?
Had one of those moments.
It was fast though.
All right, gentlemen, we'll get back on the agenda. Next on the agenda is Historical Society. Mary Warner. Emil. Welcome.
Welcome.
Good morning.
Good morning, ladies.
Good morning.
Let's do that all together.
Okay,
Thank you.
it's my old sewing machine.
Thank you.
Thank you.
So I'm Mary Warner, Executive Director of the Morrison County Historical Society, and
Camille Warseka, Board President.
and we thank you for inviting us to visit with you every year. We enjoy doing this, being able to talk about exactly what we've been up to and touching base with the board. So for 2019, what I've given you is our updated statement of program service accomplishments. We create this list every year that goes with our IRS Form 990. So that's our nonprofit tax form that we have to submit. And this is a really great way to show all the different activities we've been up to each year. And when I'm compiling this, I go through our staff reports and our calendars for the year, and I'm always amazed at how much we've gotten done. It never feels like it day to day. And 2019 was unusual in that we were, the museum was kind of torn apart in terms of having received a legacy grant to install mobile shelving in our archive, which meant emptying the archives and filling up our research room, which is our primary room for public events. So it was quite the challenge to have events, actually, within the museum this year, but we still managed to get quite a lot done. I welcome you all to come out and see the mobile shelving, which is beautiful, and we're very much enjoying it. And it's allowed us to put more stuff into the archive than we had been able to before. And if you'd ever been in our archive before the mobile shelving, you could see stuff stacked in aisles, and it was really difficult to get around. With the mobile shelving, we can't stack stuff in aisles because we couldn't get it open if we did that. The other things we've been working on within 2019 is we launched a capital campaign. We have a number of needs for our building, capacity improvements in terms of adding more shelving and maximizing the use of space, but also a number of repairs that need to be made to the building just because of its age. It was opened in 1975, so it's over 40 years old, and it's just ongoing maintenance. And we have a specialty building, so things are not necessarily cheap. And so we're trying to raise $2 million to cover all of the necessary repairs and improvements. A really huge thing that occurred for the Historical Society in 2019 is that our collection from Little Elk Heritage Preserve, which was within Doug Burke, the archaeologist, within his collection while he was still working on it. Once Doug passed away, we were to get that collection back. Well, what we've done is we have worked now with St. Cloud State's Department of Anthropology, and the entire collection is on permanent loan with them. And that will allow the students in the archaeology department to continue studying those artifacts. Rob Mann is the professor there who is very excited. He worked with Doug, but he has done his own archaeology at that Little Elk Heritage Preserve site. And so he's going to be taking that collection and getting it really organized. They're working on that now. And being able to use it to teach other students how to do archaeology actually in the field. And they're actually working with us for programming, because here we are, we're in Morrison County, it's our collection, and we have a site. At Little Elk, there isn't really a facility to do anything other than on-the-ground archaeology. So we're working on that, and in fact, we have a bead exhibit, so we're putting items on exhibit that are all beaded, including 3 Ojibwe bandolier bags. And I have asked Rob for beads from the collection to add to our exhibit, and he's working on that now too. He's pretty excited. He's like, wow, we didn't think things like this would happen so quickly in terms of partnership. And it's like, well, you don't know us very well because we move on things. So that's a huge deal for us, and that'll be a very long-term partnership. In 2019, we also created, actually our preservationist, Amory Johnson, created a series called Exploring History and Culture in Central Minnesota. And we work in partnership with the Benton, Stearns, and Sherburne Historical Societies to bring in programming from a cultural museum within Minnesota. And so in 2019, we had the Somali Museum of Minnesota, and we just finished up having the Museum of Russian Art. So each of our sites has one set of programs on a Saturday from these different museums, and so it's a way for us to bring different cultural programming in that we maybe don't have the capacity to do ourselves. And it allows those museums to get out into the state. 2019, we had, once again, I'm like, how did we manage all this with the mobile shelving project? But we decided to do a tattoo exhibit, the story behind the tattoo art in central Minnesota, and that involved taking photos of people's tattoos and gathering the stories behind them, because they all had stories. And then we also interviewed a bunch of the tattoo artists in the central Minnesota area and added their stories to it. And what I found was super amazing is that these are artists who have found a way to make a living from their art, which sometimes, it's a little dicey, but they have shops. They're, creating art every day that walks around. So their canvas just moves all over, and just they're super dedicated to their art and to their customers. Another partnership we entered into this year was with Rethos. Rethos is the new name for Preservation Alliance of Minnesota. And Jan Warner, our former executive director, she was, I believe, on the founding board of Preservation Alliance. So we've had a long partnership with them, actually. But we've been working with them informally to bring some of their programming for historic preservation training to Morrison County. And this year, or in 2019, we formalized an agreement and became the Central Minnesota Education Coordinator for Rethos. So we are offering more programming in terms of teaching people how to take care of old windows and old doors. And I know Anne Marie is working on getting some realtor classes for continuing education. And in fact, we have a couple of upcoming classes, repairing and restoring old windows on March 21st. And it's Central Minnesota, so we're working within several counties with this. So that one's going to be in St. Cloud, but then we have egress education, a door and window repair workshop, because we have doors that need to be repaired, and that'll be April 4th at the Weyerhaeuser Museum. And one last series of events we've got coming here in 2020 that I just want to highlight. So along with our bead exhibit, we're also doing an Ojibwe culture series, and we'll be bringing in a couple of authors to do book talks. They're Ojibwe authors. We're going to be doing Ojibwe genealogy, which I'm really excited for, and then a bead applique class with Cheryl Minima, who is an Ojibwe bead artist. Bead applique, those bandolier bags I mentioned, they are created with using bead applique. So they totally encrust a bag with beads. And so Cheryl is going to come in June and teach us how to do that. So excited for that as well. Now I'm going to let you see if there's anything you need to add.
No, I just want to express the board's appreciation to the work that our staff does. It's for the limited hours that they have, they do a fantastic job, as you can hear, and always looking for new creative ways, exciting ways to preserve and present Morrison County history.
Do you have any questions?
Mr. Chair, I don't know if that I have a question, but I have a comment.
Sure.
I'm going to be very careful in how I say this because I'm not going to say the best. I'm going to say one of. One of the best-kept secrets in Morrison County is on South Lindbergh Drive, right across from the former Smuda Zoo, right next to the Pike Creek, right alongside the Mississippi, is the Weyerhaeuser Museum. In a little building, it's got more stuff going on than is imaginable. And I really mean that. You know, just the stuff, Mary, that you talked about here, this is taking place right in our backyard in that little building. But I do have one quick question.
Sure.
And this is ignorance on my part. Is there a basement?
Yes.
We have a small basement. It's under a part. So there was an addition to the building in the 1980s,
Okay.
a planned addition, and so there's a basement under one section of it. It's kind of one of our collections rooms, and then there's a collections room above that. So those are typically spaces that the public isn't in because they, hold most of our collections.
Yeah. Very good.
And that's the next site of our shelving upgrades. And I lay there at night once in a while thinking about how do we get that stuff up the stairs? And the board, helped move everything out of the archives upstairs, but those are rather interesting stairs to go up and down, so I'm not looking forward to that.
I would just like to add, thank you very much for all you do.
You're welcome. I should point out, too, as part of the mobile shelving project for the archives, when we got the legacy grant for that, one of the things we did was hired an archival consultant to go through a number of collections that we have not had time to go through. Sometimes we get a really giant collection in and staff just doesn't, we can't get around to even sorting it out. And so our consultant has been working on 8 different collections, one of them being Faye Petron's, former county commissioner, her collection. And so that one has now all been sorted and reorganized, and now it's much easier to access. It's actually on the new mobile shelving instead of in the basement where we really couldn't, we could get to it, but it was just not organized and usable at that point. So, yeah, and we're quite excited to be able to find these items that are there. We just haven't had time to look for them.
Mr.
Very
Chair,
good. Commissioner Winter.
when you ask, say, a collection, how do you determine whether the collection comes in or not? I mean, is people cleaning out their garages, or are they bringing in stuff that maybe just from central Minnesota? What determines the collection?
So that is a really interesting question, and there are a number of factors that we're looking at. First of all, it's got to have a connection to Morrison County. Now, that didn't always happen in the past when the museum was young and you were still first starting to collect. I mean, we have collections of Life magazines, not really specific to Morrison County, and everyone saved them. So we're very specific because we have a very limited space. We have to make sure it's connected in some way to Morrison County. We have to see, is it something that will fit in our space? So very large items are things that we're like, nope, we just don't have room for them. And then we start looking at what the story is behind the piece. Is it something we already have? You know, if we already have a typewriter, I don't think we maybe need another typewriter unless there's a really compelling story behind it. So say we end up with, it was maybe the typewriter that Lindbergh, typed his Spirit of St. Louis on, right? That would be a compelling story. So that's the kind of thing we're looking at. However, even given that, we still have lots of people cleaning things out. They all have fascinating stuff, and they want to bring it. They don't want it to end up in a landfill. They want it to continue on with the history, which we totally understand, but we still have to find limits because we only have so much space. So we just did a futurism retreat Saturday, and we've been talking about what do we do in the future with our space and the collections. And we've decided we need to create a committee to determine exactly what our factors are in deciding what to take in and what not to, so that we can kind of limit things further and have something that we show people on a piece of paper that says, see, this is what we're looking for,
Great explanation, thank you.
You're welcome.
Gentlemen, anything else? I would just like to say thank you too, Mary, Camille, for coming here today and for keeping history alive in Morrison County. We appreciate everything you do.
Thank you.
Thank you
And
very,
you give us an opportunity to talk about what we're really proud of and, and
Absolutely.
excited with. And as also talking about being a secret, one thing, you've done a letter of support on the bonding bill that Ron Krisha and Paul Gazelka have put forward. Even what that has done for us too is we're really connecting more with the community on that, using that as a facilitator for discussion and presenting to the cities and counties. So we appreciate that.
thank you very much.
Thank you so much.
Thank you very much.
Ladies, good to see you.
Next on the agenda, social services, Brad and
Good morning,
Bonnie.
Mr. Chair, Commissioners.
Good morning.
Good morning. So this morning, my first report on the social service side and only report is on our collections activities. So collections is an important function in terms of the fees we charge, the overpayments we collect, MAS states. So Bonnie put together some information for you and is going to present on the slides. So is there any chance they could be up here?
I forgot I turned it off for,
Just in case you want to look at them where you're at.
my fault.
Thank
Is
you.
it turning on?
Thanks.
Is it on?
Good catch, Brad.
Good morning.
Good morning.
Morning.
So I'll just start out by saying that we're doing things a little differently than in the past, how we're recording things, looking at things. So in July, we had a new collections officer start, Steve Castoris.
And I will just point out, he is in the back of the room.
Well, I think you
so-
should stand up and wave.
I think so, absolutely.
Okay.
wave,
You can
or
sit and
just
wave.
wave.
All right. Next time.
All right, so Steve and I have worked closely together, developing and putting into place efficient processes so that we're better able to track things as well. We're really taking a team approach to everything and helping clients understand what they owe, why they owe it, and how to repay it. So we've forged really good working relationships with other county departments, and we're going from there. So, starting with the slides, so we collect from two totally different systems, or track through the systems as well. So first is the public assistance system, Maxis, and then the agency collection system, which is just ACS. So the first area of recovery is MA estates, and we collect these for federal, state, and county dollars. We're tracking them on ACS and providing the information up front so that we know where to post a payment when it's received. We're providing a place for notes, set up and track arrangements, and to send monthly billing statements. So you can see that our collections for the last 3 years, 2 of the 3 have been above what we have budgeted. So the second area that we collect for the feds, the state, and the county are the public assistance overpayments.
Can you go down 2 slides? So there's the MA estate slide, and then the next one is the public assistance slide.
Thank you.
Thanks.
So the public assistance piece, our share of the collections varies based on the program, but it ranges between 13 and 50%. So in addition to the general assistance, MSA, TANF, et cetera, that we've been collecting on, we are now also collecting on childcare overpayments and housing support vendor claims. We obtain judgments on some of these, which allows us to charge and collect interest. So we've collected for 2019, $4,800 in interest. We also set the claims up for revenue recapture, which allows us to recapture or to capture state property tax as well as state tax refunds. We rolled out a new detox procedure, and we've collected about 29% over the budget in that category, which was actually quite a large number. I think it was like, over $20,000 that we've collected just for that program. And then graph number 4 just shows how we collect our dollars, where they come from. Third-party payments can be. The next slide. So this graph just shows where the majority of our payments are coming in. So third-party payments can be what's left over after the funeral payments, or somebody coming in on behalf of somebody else making a payment, different things like that. Shows where our interest is and such. And then the last slide, number 5, is just showing both systems together, how much we've collected and toward what programs. That's all I have.
So probably the question we get, the largest question we get is about MA estates, and for you, those of us that plan for our parents or our grandparents, if they apply for MA, and both parents end up in a nursing home, or there's only one parent left and they end up in a nursing home for a period of time, then we will collect on their estate when they try to sell their house or some property or those kinds of things. And so that's probably the area that fluctuates the most, depending upon what families might have left from their parents or grandparents or spouse.
Is that where that falls under MA estate excess then?
Yep.
Okay.
Yep. And foster care again is another large area of expense and does not nearly cover the costs of our foster care, which is about, I think we're budgeting 1.6 million this year for foster care. But that's, we're charging families, and then we also get a payment from the state to offset some of our other adoption foster care payments, so. If I may, Mr. Chair, when you say you're charging families, if I'm a foster parent, what are you charging me, or are you charging the? We're charging the birth family. Okay. Yep. So it's a critical function, both in terms of, revenue, but also in terms of holding families, individuals accountable for costs of some of these programs. So, and as Bonnie said, Steve's fairly new. I don't think it's been a year yet, so, but he's done a great job in trying to organize to fit his work style and Bonnie's work style, and they've done a great job working together. So, thank you both.
Mr. Chair, I think it's important to kind of note that exactly what Brad said when he referred to the fact that there are systems in place to try to recoup some of this general expense. And so I don't know that everybody realizes that there are these systems in place, and that it isn't just just paid for and no thought is put into the fact that people may have assets or they may have dollars that really ought to offset some of those expenses that are put out there. I don't know that everybody really realizes that. So it's good work, it's important work, and it's, thanks Steve and Bonnie for doing that.
Commissioner Wilson?
Brad, I got a couple questions. Public assistance overpayment. Overpayment comes from what? Somebody passed away and maybe didn't say something, or wrong information, that type of stuff, or?
Generally speaking, they don't, they aren't honest with their income
Okay.
when they're applying for a program.
Okay.
And so, or to some degree, somebody might have forgot to update our system on added income, overtime, those kinds of things, but usually it's because they didn't give us the correct amount of income that they would have, which would then determine how much they would qualify for.
So on, I'm sorry, you done? Oh,
Well,
that's-
the MA estates, just to clarify, we do not take property from people, correct? They have a sale or whatever, then they pay the bill. Because a lot of people, I think that when they're getting assistance, nursing home and stuff, then we take their property when it's done, but we do not do that, correct?
We have not taken property, we've taken the benefits of the selling of the property.
Yep.
There are some counties actually that do take property, will take houses, will do all of the work around that. We have chosen to keep that in the hands of the family. There are a few families have tried to turn over their estates to us, and we have not obliged, and we've asked them to take responsibility for that.
Sounds good, thank you.
On that income question that was asked on, they didn't put the proper income down on their form. How do you catch that? Is that caught by the IRA or not IRS?
Our financial workers have access to some systems that show income through the Department of Revenue. So it might be that way, or we might get a phone call from a neighbor or a family member, or there's a number of ways that we can catch up with what they might not be reporting.
Very good. Gentlemen?
Mr.
anything else?
Chair?
Yeah, Commissioner Jelinski.
Ultimately, you do take property. At the end of the day, if the case is where whomever, the estate has property, the estate simply gets sold, and off the top, I think, I just want to make sure if I'm even on the right page, ultimately, comes off the top is to pay off bills, if you will, and if there's X amount that was charged to MA, as an example, that would come off the top, right? Or no?
It's not the first debt that is paid. If there's leftover medical bills,
Okay.
couple of things like that, the state has a debt priority. So we're basically about number two. The
Okay.
funeral expenses, any unpaid
Yep.
medical, things like that, and then us.
Because I think that when we just use the term collections as a whole, well, do we give loans? We really don't give loans. Ultimately, we could call it a loan sometimes. I mean, we could, but it's really not. It's collecting on sometimes human error,
Correct.
and sometimes simply on overpayment, as you said.
When it comes to property and estates, though, it's, we don't collect nearly the amount that a family or an individual might have used in terms of their medical costs. It's, again, whatever is available from the estate after the estate's paid off, and as she said, we're second or third on the list, depending on. And so, but we also know that it's important to recoup some of those costs that the state and federal government are incurring in caring for folks, so
sure.
if they're eligible or able to.
Thank you.
And again, there is a whole, attorneys make a living in helping families determine how to best manage their property and their estates. And we give that information to families when they come in and apply as well, that if they're interested, that's what they need to do, so.
Very good.
Thank you.
Thank you, Bonnie.
Thank you. Thank you very
Brad.
much. Thank you, Brad.
All right, I have a public health report now. And we thought this might be a timely presentation around disease prevention and control, given the conversation around COVID-19. But that's just one piece of what disease prevention and control does. So Cindy's gonna kind of give an overview of what this program encompasses. And then we are gonna talk a little bit more in detail around COVID-19, so.
Morning, Mr. Chair, Commissioners.
Morning,
Good morning,
Cindy.
Cindy.
So disease prevention and control is one of the 6 public health responsibilities. Number 3, preventing the spread of communicable disease. So by statute, we're required to do this work. And it simply means that we keep track of infections that are happening in our county. We respond appropriately. We do what we can to contain and prevent, including promoting vaccines and things like that. Slide number must be 4. Disease prevention and control activities. There's a 35-page document that's the state framework. I'm not going to bore you with the details of that, but the Minnesota Department of Health has a very, very well thought out plan that's reviewed on a very frequent basis. And clearly they've got that out and dusted it off now with our current situation. So before we get to COVID-19, I'll just talk a little bit about some of the other things that we do. We track what's going on with influenza. The Department of Health keeps a lot of statistics on that. And quite frankly, we're still very much at higher risk for issues with influenza right now than we are for COVID-19. We get weekly updates. We are still considered to be in a widespread outbreak for this year. The numbers that are on the slide are last week's numbers. They're updated every Thursday for influenza. So last week on Thursday, the numbers went up to 3,254 for actual hospitalizations. That's not just people infected, but actual people that were admitted to the hospital. 95 adult deaths and 2 pediatric deaths. So it's still very, very active. That number for schools that were reporting influenza-like activity is now up to 848. And 80 long-term care facilities are still reporting outbreaks. And of course, that's our very high-risk population in the long-term care facilities. Early on in the influenza season, B was more prevalent in children. Now we're seeing an increase in influenza A, which is more prevalent in adults. That's leading to the hospitalizations. Next slide. Vaccine preventable diseases, some statewide statistics. Pertussis, which is whooping cough. So far this year, we've already had 23 cases. That's concerning because that's a disease we can prevent with a vaccine. So we really want to continue to encourage the vaccination. The prevention for that includes vaccination of pregnant women so that those infants who can't get the vaccine till they're 6 months old have some coverage prenatally. We've already had a case of mumps, not here in Morrison County, but in Minnesota. So these are Minnesota stats. Last year, there was 11 cases of mumps. Again, that's a vaccine preventable disease. Varicella, which is also known as chickenpox, 323 cases last year, another vaccine preventable disease. Knock on wood, we have not had any measles in 2019 or 2020. So let's hope that we stay ahead of that.
Mr.
Chair, Cindy, I'm sorry,
Yep.
can I interrupt for just a second?
Yep.
And I don't, but as long as it's right here.
Yep, go ahead.
When you just said preventable disease,
Vaccine preventable, meaning if people
So-
are vaccinated, there is a very small chance that they
so
get
we're
that.
probably saying that in 2019, there was 323 cases probably of people that were not vaccinated and they then got chickenpox.
Absolutely.
Okay, very, I'm sorry, thank you.
Mr.
Yeah.
Chair, I was going to ask a question about, what is the percentage of vaccinated people?
We are at close to 80% in Morrison County, 78, 79%. We're typically number 2 to 3 in the state. During that measles outbreak in 2018, Hennepin County had the bulk of the vaccinations, and believe it or not, Hennepin County has the most vaccinated people in the state.
Had the bulk of the diseases, you mean?
Yes, they
Okay.
had the most people with measles, and they had the highest vaccination rate. So there was still a significant outbreak, because that means there was still a significant number of people that were not vaccinated.
And if I may, Mr. Chair, to get in the weeds a little bit, if you're going to school, you're putting kids in school, aren't they required to have these vaccinations?
People are allowed to abstain.
Are other parents notified then that these children are not
I
vaccinated?
don't believe that they can
Okay.
do that. If there were an outbreak, my understanding is that the Minnesota Department of Health
could ask those students who are not vaccinated to stay home. That would not be up to us as a county, that would be a call on the part of MDH. So families are made aware that if their child's not vaccinated, that during an outbreak, they could be kept from school.
But they are not made aware of if my children or grandchildren are vaccinated, I'm not gonna say that your children aren't.
No, we
They're
can't
not-
share that
we can't do
information.
that.
It's a-
Or
it's
that
a
they're
medical-
They're in the classroom on not having the vaccination. So it
No.
works one way, so it's kind of.
Basically, yeah, unfortunate.
And I think schools wrestle with this every year in terms of what or how to manage that. And I think from a legislative standpoint, the legislature wrestles with this, especially when there's outbreaks about whether or not should they be more firm on kids going to school. And again, I think it's a challenge whether or not to require it or allow those people to avoid that, so.
So our role from public health standpoint is just ongoing education about the advantages and the reasons to vaccinate. You know, there's just a lot of information out there about vaccinations being unsafe, which has been debunked, but, you know, we have to fight against that. We have to continue to point out the reasons to vaccinate. Next slide, the hepatitis A outbreak. We've talked about this a little bit in the past. It's impacting the high-risk groups, people that are using injection and non-injection drugs, people that are homeless, and people that are incarcerated. Here in Morrison County, we have not had an active hepatitis A case, but we are very closely connected to counties that have had cases, including Crow Wing, Mille Lacs, and Stearns. So the state has really pushed us hard to make sure that we're working with our jail staff to get those folks vaccinated. Audrey, the jail nurse, is in weekly contact with our staff. I need this many doses. Because we no longer have a vaccine fridge, she runs to the hospital, picks them up. We keep track of the inventory. The state reaches out to me once a month. How many did you vaccinate this month? So they're really keeping tabs on that. In the summer of 19, when we were declared to be in a hepatitis A outbreak, there was less than 40 cases. As of last week, we're at 87 cases, so that number went up by one more. So it's still concerning. Next slide.
I'd just like to again give Cindy credit for the work she did with Audrey at Mend in the hospital and organizing and ensuring that those in jail got the hepatitis A vaccine. And now Shelby is working with Cindy on that. So Cindy did a great job as this outbreak grew in terms of coordinating with those entities. So a very nice job.
Thank you. The Mend jail nurse has now been given MIC access, so that made my job a little bit easier because she first looks up to see if they've had hepatitis A, because most people don't really remember what they've had. So if they haven't, then she offers it, gives them an opportunity. Once it's been given, she also goes back in and records it. So she's working within that MIC system, which has made it much simpler. Talking about syphilis and HIV, again, those are two diseases that are impacting those high-risk users, very much similar to that jail population and the homeless population. We've had very little impact in this area, but Northwest Minnesota and the metro have seen increases in those diseases. Next slide. Foodborne and waterborne illnesses. Just to touch on this a little bit, norovirus, it's not stomach flu. If someone has nausea and vomiting and diarrhea, it is not stomach flu. It's typically norovirus. We're seeing a lot of activities in that in our long-term care facilities. It's easily spread. Some activity in schools as well. When there's an outbreak, we typically get notification from the Department of Health saying you've got a facility in your county or a school in your county that has high numbers that have been reported. So we just keep track of that. And we have had some in our long-term care facilities in the county and in the schools. We're constantly tracking trends. If there's somebody that says, I got sick because I ate at XYZ restaurant, that comes through our environmental health for investigation as well. Next slide, tuberculosis. Morrison County continues to be at low risk for TB. In the past year, we had one latent case, so a not active case of TB that was transferred in from another county. So that was a person that moved here and just needed to have monitoring to make sure they were taking their medication. As far as active cases, the last time we had one was in 2016, so that's also a knock on wood situation. Regarding TB, the national trend is that TB is going down. However, our statewide trend is that TB is going up. And that's basically related to immigrant population. The pre-entry exams, even though people are screened, are not reliable. So people are screened and get into the United States, and after they get here, someone says, wait a minute, let's double check, and sure enough, they have TB. Probably the biggest concern is that there's multi-drug resistant TB. Just like all other diseases, the TB has modified itself to be very resistant to the medications that are out there. People need medications for longer periods of time, and they need multi-drugs to get it cleaned up. Next slide. When we have a TB case, a latent case simply means that the Department of Health sends us their medication once a month. That person comes in, picks up the medications. If for some reason they don't have transportation, we would possibly deliver them. We do an assessment, whether it's in person or over the phone, depending on that situation, and just making sure that they're taking their meds. That's not a person that's actively contagious, that they are not quarantined, they can be out in the community. However, if you have an active TB case, the situation becomes very different. First thing we need to do is education for the clients and the caregivers. We start daily observation therapy, so that means 5 days a week, one of our staff literally physically drive to that location and watch the patient swallow the medication. So it becomes very labor intensive when we have an active case. Stearns County has anywhere from 10 to 15 active cases at any given time. So the fact that we have none is awesome, but because of how close we are to Stearns County and their mobile population, we're just one phone call away from that. Stearns County has actually started doing video monitoring, so they're setting up video equipment in the homes and having the patient swallow the medication while it's being monitored by a nurse on a monitor. So if we were to see an increase, that would be an option we might want to look into to reduce our staff time with that. The other thing that we do with those folks is then when the Department of Health and the doctor say, okay, I need a sputum collection, our nurse has to collect that sputum, send it down to the Minnesota Department of Health lab, follow up. They have to have 3 clean sputums before they can be taken off quarantine. So the last active TB case we had was about 5 months of daily therapy. That one was a pretty intense case, but that's not unusual for them to go like that. So when we get a phone call about a TB case, we immediately know we've got a lot of time invested. Mr. Chair, is there a vaccine for that? No, there is not. And most TB cases are people that obtained it in other countries. It's not real endemic to this country.
So, Mr. Chair, when we are going to the home of any of the folks that we're talking about here, what precautions do we take?
Our staff are wearing the N95 mask.
Okay.
The last time we did one, it was actually summer, and so we always met the client outside at the picnic table because you have less likelihood of picking that up when you're not in an enclosed space.
Okay.
Obvious other precautions, hand washing, et cetera. So the client wore the mask as well as the staff
But
person.
that's it? Mask and hand washing?
Yep.
Okay, very good.
Maintaining a healthy distance.
Yep. Nope, gotcha.
This next slide just talks about the TB cases in Minnesota. So the last data that was available was the third quarter of 2019, and they were up to 94 cases in 2019, and they totaled out in 2018 at 120 cases. So we're still on track again, the way it looks, to continue around that many. You divide that out by 87 counties, it's pretty unlikely that every county is going to get off without one periodically. So now the star of our show, COVID-19.
And we'll say that this is already old news as of, 9 or 10 o'clock this morning compared to 8 o'clock this morning. So I'm sure while we're sitting here, there's more activity happening. So Cindy did update some things, so all the numbers in here are not.
I had to have this report ready last week, so.
Look, this morning, these are not probably updated as of yet either, so.
The CDC updates their COVID-19 numbers every day on their website at 4 o'clock. So at between 4 and 5 yesterday, I got those most recent numbers. So COVID-19 is what they call a mystery pneumonia that started in Wuhan, China. And really COVID-19 Coronavirus is really a relative of the common cold. Common cold is a coronavirus. The reason that they called this one 19 was just the year that it was discovered, and they called it the mystery virus for a while because it was new. It was a mutation of an existing one. Our first case was on January 21st, 2020 in the United States. 10 days later, the Department of Health in the United States declared it a public health emergency. So that 90,000 cases globally yesterday was updated to 109,577 cases. 80,000 of those are in China. The deaths are at 3,800 in China. Our US cases are at 423 as of yesterday, with 19 deaths. And from last week, we went from 12 states up to 35 states. So, pretty rapid multiplication. What I was listening to this morning is that they are saying the number of new cases in China is starting to slow down. They're not getting as many cases as rapidly. So that was about a 2 to 2.5 month span that they feel like they're finally going the other direction as long as they continue to contain what they can. So that's excellent news. That does, however, mean because we've only had cases here in the United States since January, we're probably nowhere near our peak yet. Next slide. COVID-19, a lot of the cases are really pretty mild. The cases that we have right here in Minnesota right now are not hospitalized. They're not severe. However, there can be a percentage of them that are very severe. The symptoms, fever, cough, shortness of breath, very similar to influenza. So that's our struggle right now. We're in the midst of the influenza season as well. So it's very hard to discern which one it is without testing. Incubation period, they're holding pretty firm that it still remains anywhere from 2 to 14 days. The recommended isolation precautions are standard contact and airborne. So that means masks and gloves. Eye protection if you're treating somebody that you know. Hospitals, if they do have somebody in admission, are using the negative air pressure rooms. Currently, there is not a vaccine. The CDC and the World Health Organization are working on that 12 to 18 months out if they can develop one. There's no guarantee yet. Just like influenza, it's a little bit of a guess what the vaccine needs to look like, so that's a big challenge. Person-to-person transition is more common. However, they do know that it stays on surfaces for up to 9-10 days. So good cleaning of areas that we know infected persons have been very important. Prevention and transmission, they just keep saying hand washing with soap and water. There is not good data that says we have to use antibacterial soap. Most people think we do. The reality is the reason you use soap is because it helps the germs slide off your skin. So any soap is fine. Avoid touching your face, and then you've seen all the stuff on TV about people while they're doing their presentation touching their face. So very common thing. Wipe down contaminated surfaces, wearing a mask if you're feeling unwell. We know masks are hard to come by. And then seeking treatment if you're not feeling well. They're definitely saying avoid crowded places. Currently, the treatment is supportive care and hospitalization for severe cases. Most people recover in 10 to 12, 14 days. So my slide regarding Minnesota, last week there was 5 persons under investigation. Now that we have the ability to test, the number of people being tested is increasing. So the newest numbers are 82 people have been tested in Minnesota. 2 of those have been positive, both travel related. We have had some information from MDH that we're in the metro area, especially trying to do some outreach to Chinese Minnesotans. There's some issues with people treating them badly because of their race and related to COVID-19 in China. So if we had something like that happening, we would be trying to provide support to them. Next slide. Weekly calls. So what are we doing here? MDH has a call every Tuesday afternoon at 1 o'clock. Typically, at least 1 or 2 people in public health are listening to that, getting the latest information and guidance. They put out a Q&A on the MDH website, and all of you can access that. That's a public site. We're able to test here right now. Our capacity, we're told, is about 100 tests per day. I think that will increase. They're talking about it being brought into clinics and hospitals. Right now, it's only at the MDH lab. Prior to 2 weeks ago, it could only be done at CDC in Atlanta. So this is really key because we can identify more cases. Our numbers in the United States are low, partly because they think we had a really, really tight criteria for who could be tested. Now that we have more test kits available, more people will be tested, and it'll probably loosen that up, and we'll see our numbers climb as part of that as well. We are fielding calls from the public. I had 3 yesterday. Everything from, when do I shut down my daycare? I don't know. MDH will give us that guidance if and when that happens. What do I do because my in-home daycare is taking a cruise at the end of the month? I don't know. You need to wait and see what happens. Maybe the cruise won't even happen. I don't know. And I had a caller yesterday ask, should I go to the dentist? So, you know, everybody's worried. Last week I had a caller with influenza demanding a mask. We don't have masks to give out, and if I gave one out, I'd have a line around the block. So those are the kind of calls that we're getting. Most of the time what we're doing is first just addressing their question and then referring people to the Minnesota Department of Health website, the CDC website, and encouraging them to spend less time listening to the news and more time looking at the reputable resources with the latest information and guidance. We also have the opportunity to listen on Thursdays. There's a weekly phone call for healthcare providers, and it's more focused on hospitals, but we're trying to keep our pulse on that a little bit too, because obviously we would need to partner with them if there was an outbreak in our area. So our response is really carefully coordinated. MDH will be giving us guidance. If we have a case in our county, they will give us the direction. It would be similar to TB in that there would be a contact investigation. Who did they have contact with in the last 2 weeks? How close was that contact? Was it within 6 to 10 feet? Was it more than 10 minutes, or was it across the room? Determining who needs to be isolated. If there was a widespread outbreak, then we would cross over into an emergency response and bring in our public health emergency team. So we're coordinating with them as well. We're not an island in this. We know that if it gets larger, that it's not going to be just a public health issue. One other thing just to make you all aware of on the calls from MDH is they've given us very strict guidance. If we did have either a person under investigation or an actual case, an actual case would probably become public knowledge, but a person under investigation, we are not to communicate with our local public officials, i.e. all of you. So don't be surprised if all of a sudden somebody says, oh, there's a case in Morrison County and you didn't know somebody was under investigation. We've been asked to even keep that down to 2 to 3 people within our public health agency, just to try and protect the privacy of the individuals.
Mr. Chair, can I ask a question? If the treatment is such that it's not severe, or the typical response isn't a severe reaction, why the ramped up contact investigation, or what's the thought behind that if it really is generally mild?
If somebody has, it's just to try and contain. So if somebody has an actual positive and they've had contact with 10 people, right now those 10 people are asked to self-quarantine for 2 weeks.
But the response to influenzas, I mean, the difficulty with influenzas, the same or more, but that's not a
I
quarantine.
agree.
Okay.
I agree, and those are the CDC guidelines.
That's
Yeah.
just hard to understand, I guess, the thought process.
Corona is a lot more contagious than the flu is. It's easier to transfer to one another, isn't it?
There isn't really good information on that. They go back and forth on that. The person-to-person transfer is pretty significant. It's airborne. They say it's less contagious than measles. You can be 20 feet from someone with measles and get it, but you need to be within 6 to 10. So it's mostly the cough
So cough and droplet spread, so covering cough, getting people to stay home when they have a cough. That's key.
Yeah, and I think we will continue to see information ramping up, and, we will take our direction from MDH as far as some of the things that we have to do, but it's interesting, because this morning I got in the mail an advertisement and an opportunity to buy cards like this, which say COVID-19 on it. Nice little informational card, so our agency could buy up to 100 for $5 and up to 1,000 for whatever. So I think we'll be seeing more and more of this as information becomes available. But I think we're gonna continue to work with MDH on some of those activities. I do know that Todd County opened their Emergency Operations Center yesterday as a way to kind of manage information. I talked with Jackie Yock yesterday. Actually, Friday afternoon, they were pondering doing it. We have a meeting with Victoria this morning on a statewide exercise that is coming up, and I have not heard that from her as our emergency operations manager. And I'm not, even with Jackie, it's unclear yet what kind of information would flow through there and how it's going to be managed, but that was a decision their emergency manager made on Friday afternoon. So, and I know other counties are ramping up in different ways. And we are paying attention. I know some businesses are telling staff, take your computers home because at some point we might quarantine you. They're asking their staff who have been on cruises not to come back to work. And so I think we've seen a lot of different actions and activities from small businesses to large businesses to counties to regions to and so I think there's still a lot of unknowns in how to manage this so that we don't see as significant an outbreak and as number of deaths as maybe China has seen, but.
Mr. Chair, just from a county perspective and the staff that we have, of course, we give the direction, if you're sick, stay home. We want people to behave responsibly, but I haven't forced people to stay home because I don't know that I'm in a position to do that right now with the level it's at. But we'll follow the direction of MDH and see where we're at with that. But I think it's always the responsible thing to do to make sure you stay home when you're sick so you don't infect others regardless of what you have. I mean, we had a regular kind of flu spread the other week. It's hard not to if somebody's sick in an environment where we're working very closely together. And so it's always tough this time of year, always difficult to make sure we keep things contained. So just being responsible is the message that we're sending to staff at this point.
Something that I didn't address, but just an FYI, is that quite a few of the calls that we're getting are related to daycare, and actually children are far less susceptible to the coronavirus than adults are, and it's that over 60 population that's the most vulnerable to coronavirus. So we're, really trying to reassure parents, not that your child can't get it, but they are actually much less likely. And they've seen far fewer deaths in China to children than what we're seeing here from our influenza. Again, it's not too late to get your flu shot too.
As we've seen in Seattle, the outbreak in a senior living facility is probably the greatest concern, and how do we manage that?
Other questions?
Commissioner Wilson?
I just want to thank you for keeping everybody informed, and it sounds like you're being informed yourself.
We're doing
And
what
it
we
changes
can.
all the time, so I'm very confident that if something happens, that we're all prepared to do what we need to do, so
We'll
thank
do
you.
our best.
It is nice that the state can now test here, because as Cindy indicated earlier, the CDC had very strict guidelines for testing, and I know some healthcare facilities that wanted to test people that were coming through, and they weren't willing to do that, so, but I think now that the state can test, it will help us better understand kind of how this is going to spread, so.
Thank you, Cindy. Thank you, Brad.
Thank you.
Thank you
Thank
very
you.
much.
Have a good day.
You too. Land Services? Morning, Amy.
Good morning.
Galen?
Yeah.
Good morning.
Okay, I just have one item for you today, and that's to approve the recommendation of the Aquatic Invasive Species Grant Committee recommendation for award of the 2020 AIS grants. I believe a copy of the recommendation was in your packet. We have a total of $46,831.70 6 whole cents that we would like to grant this year.
Gentlemen, could I get a motion and a second?
So move.
Motion made by Commissioner Wilson,
Second.
second by Commissioner Jelinski. Any discussion? Commissioner Wilson and myself and Amy and Galen met together, and this was the recommendation that we had to bring forth to you. We made some changes. Some were pretty vague on how they were going to propose to do what they recommended, and so they didn't get everything they got, but
We really were.
anything you want to add on to
Yeah,
that?
Mr. Chair, we were really evaluating these requests against the criteria for the grant, and then also how it fit with our AIS planning document that we have put together. And so that's how we evaluate these applications and make the decisions that we do for recommendation.
Some did a very good job, were very informative
Yes.
and followed the rules put forth, and others were very vague, and Galen had to do a lot of extra legwork that he shouldn't have had to do, but he did it, and we
And still
thank you for
didn't-
doing that.
And sometimes it works and sometimes it doesn't.
Mr. Chair,
Yes, sir.
this is funding that comes to Morrison County from the state,
That's correct.
and obviously, the Lake Association, I shouldn't say obviously, the lake associations then come up with the plan, what they want to propose to do for any given year, and in fact, this year, and that's what we have in front of us. That subcommittee, if you will, got together and came up with this plan.
That's correct.
Okay.
So we evaluated all of the grants that came in and then made the recommendation based on the thoroughness of the application and then also how it fit with our overall AIS plan.
And again, there's only so much money
That's
to
correct.
begin within the pot, and that's distributed that, okay. Very good.
Any further discussion? All in favor?
Aye.
Opposed? Motion carried.
All right, thank you.
Thank
We'll get
you.
those letters out.
Good job. Thank you very much.
Auditor Treasurer. Morning, Chelsea.
Good morning, Chelsea.
How are you?
Good, how are you?
I'm good, thanks.
Great.
This morning I have a couple resolutions before you for exempt permits, and the first one that I have here is, I just want to make sure I have the right
yeah.
one. Sure. The first one I have is a resolution, and I'm requesting approval for Morrison County Pheasants Forever to hold a raffle on September 18th of this year at the Falls Ballroom.
So moved.
Motion made by Commissioner Wincher,
Second.
second by Commissioner Blaine. Any discussion? All in favor?
Aye.
Opposed? Motion carried.
Second resolution that I have in front of you is requesting approval for Morrison County Ducks Unlimited to hold a raffle on April 24th at the Falls Ballroom.
So moved, Mr. Chair.
Motion made by Commissioner Jelinski, second by Commissioner Wilson. Any discussion? All in favor?
Aye.
Opposed? Motion carried.
I
Next
don't
up,
know, Mr. Chair, about those. Both of them usually cost me a lot of money if we go, so I always get apprehensive when they're approved because my husband likes.
mark your calendar.
But thank you, I
Now you
am,
know.
I get asked.
Next on the agenda, I have a request to open a new account. As you can recall, any accounts that I open that are checking or savings need to come forth to the board to get approval. So I'm looking to open a new checking account within the Magic Fund for the E911 dollars to track. So per Minnesota statutes 403-113, we are to have a separate account for those dollars and to track. And we have right now currently a separate line item in our financial reporting, but they are requesting under the statute to have a separate account, not just a separate line item in our books. So that's why I'm here today, to ask for approval for opening a new account.
I'll move on that, Mr. Chair, for further discussion.
Motion made by Commissioner Jelinski,
Second.
second by Commissioner Blaine. Any discussion?
Mr. Chair,
Commissioner Jelinski.
what do you mean a separate checking account? And I get what you're talking about, but wouldn't it, is this something brand new that just came to light, or?
I believe every month we do reporting for the dollars, and
Yep.
right now we have it as a separate line item in our financial
Absolutely.
system,
Yep.
which most departments and most line items, or they have different buckets, if you will. And I believe someone from a different office switched hands, and so they're looking over it a little bit differently, and they're wanting to see an actual checking account statement rather than just a line item in our financial.
And part of that is because E911 funds are absolutely dedicated to certain things, and that focus is, quite honestly, fairly narrow, correct?
Correct, yep, it's strict where
And-
the money is going in
And
and
so
out
what
of.
they're actually looking for is more of an itemized, at the end of the day, more of an itemized list of things that were purchased off of that, more so than just a simple line item?
Right, correct.
Thank you.
Any further discussion, gentlemen? Got a motion and a second. Any further discussion? Hearing none. All in favor?
Aye.
Opposed? Motion carried.
Next on the agenda, I have a request for approving board warrants. Bills to be paid.
Motion to approve the board warrants.
So moved, Mr. Chair.
Motion by Commissioner Blaine.
Second.
Second by Commissioner Wincher. Any discussion? All in favor?
Aye.
Oh, roll call. Commissioner Wincher,
Aye.
Commissioner Jelinski,
Aye.
Commissioner Blaine, Commissioner Wilson.
Aye.
Myself, aye. Motion carried.
One last thing I have.
All right.
We are 205 days away from the October 1st deadline for the real ID or enhanced with the travel guidelines. So the state is notifying us that if you are planning to have a real or an enhanced ID by October 1st, to hopefully be in our office before middle of June. So you have that in your hand on October 1st if you're planning on traveling, if you don't have a passport.
Very good. Thank you so much, Chelsea.
Yes,
Thanks, Chelsea.
yes, thank you.
Chelsea.
Administrators report. Deb?
Mr. Chair, I don't have any action items, but I just wanted to let you know of a couple of things. There was an email that went out for an AMC leadership training. If you're interested in going, let Tabitha know. We can get you registered. It's up in Nisswa. They usually do a good job with that in terms of a good speakers. It's a couple of days really concentrating on overall leadership, and it's a nicely done program. The building update, we're continuing to move forward. We'll get bids, and they will be open on the 19th of March for the parking lot. The work continues over on the west side of the complex. They're working on painting now, I believe, actually. So it's all, the walls are all up. Everything's moving forward with that. The duct work was cleaned and insulated, and so we should move forward with a really nicely, equipped area over there. And then they're starting demo work over in the sheriff's office area. So lots happening throughout the facility. The court level is complete. So if you want to run up there and take a look at that, everything's done that we're doing, at least that you can see is complete upstairs. Just a reminder that March is food shelf fundraising month around here. The committee that does work for that through social services is active in public health, and they do such a good job, and we have different events. All for the effort to be able to really do a nice contribution from employees to the food shelves in Morrison County. I think everybody is very aware of how fortunate we all are here and making sure we're spreading that on, and it's nice to see employees step up and do that. So participate, spend your money, feel free. They will take it. There's different raffles and different events for lunches and things like that. So we appreciate the work done on that. Otherwise, anything else you guys are waiting for me on or want me to address?
Not I.
All right. Good deal.
Commissioner Wincher, would you like to go first? Committee reports?
Here we go, here we go. So anyways, from the date is from when to when?
March 15th through March 28th.
28th. All right, well, let's see here. Starting on the 17th, we have a planning session at 8:30. There's also I have a Great River Regional Manager meeting at 5 PM in St. Cloud. And then on the 23rd, Planning Commission at 7 o'clock. Board on the 24th. And that kind of covers myself.
Okay. Commissioner Blaine?
I can add that on Thursday, March 26th, Region 5, meeting at 6 PM for me. Other than that, I can't add
Okay.
anything.
Commissioner Wilson?
On the 15th, I'm going to go to Royalton to that sanctuary thing on gun control.
What time is that?
It's at
1 o'clock.
1 o'clock.
VFW in Royalton.
On the 17th,
Legion, it's called a Legion. It's not a
It's called the Legion, not the VFW Tabitha.
on the 17th, I've got community development at
The
12:15.
wrong place.
On the 19th, I got RTCC board in Staples at 10 o'clock. Planning, and I've got Mississippi Headwaters on the 27th at 10 o'clock.
Very good, thank you. The only thing I have to add is,
What was the date for Mississippi Headwaters?
The 27th,
You said 10 o'clock?
yeah.
Okay.
all I have to add is the 18th, public health at 5 o'clock, 5 o'clock.
I don't think so.
Does anybody know anything about this homelessness thing on Sunday at 2 o'clock somewhere?
It's on the 15th.
Yep,
That's at, I'm sorry, I forgot, the church, I believe, right across from the hospital. I'm planning on attending that at 2 o'clock.
First United.
And then Commissioner Jelinski.
Okay? I'm planning on attending the Faith Not Fear Committee meeting at 2 o'clock on the 15th at First United. And on the 19th at 10 o'clock, got a Central Minnesota Emergency Services Board and Owners and Operators meeting in Alexandria. At 7 o'clock, I've got an Egg Society meeting. I think that's going to be at the Legion here in Little Falls. On the 23rd at 2 o'clock, I've got a Community Health Needs Assessment at the Ripley Room at St. Gabriel's. On the 25th, at 11 o'clock, the Central Minnesota Emergency Services Board Executive Committee meets, followed by the full board at 1 o'clock. On the 26th, at 12:30, I'll be in St. Paul at a State Emergency Communications Board meeting. On the 27th, I expect all of you have got your tickets already for this one. At 6 PM, Hands of Hope will have their benefit concert at the Falls Ballroom. I think the doors open at 7. That's the Neil Diamond Show.
6 o'clock, you said, Jeffrey?
I think that's at 7 is when it, actually, the doors open. They might open at 6, I can't remember. On the 28th, at 10 o'clock, Sprout is once again taking place at the Crestliner Complex. And Mr. Chair, that's all I've got.
And if I may add, on the 27th, I have a Soil and Water at 8 o'clock, which is a Friday.
And just a reminder, I will not be here
On the
next
27th.
Tuesday for Planning Commission meeting, as I'll be in St. Paul.
Yeah, and I won't be here either, so.
Both of you are gone?
On when?
Yeah, your meeting will last 10 minutes, and
I don't think Mike's gonna.
On the 24th? Or
I said the meeting will last 10
Where?
minutes.
Oh, well, whatever works.
you and Mike Wilson?
not really.
Jim, could I get a motion, a second to adjourn?
So move.
Motion made by Commissioner Wilson, second by Commissioner Blaine. Any discussion? Hearing none, meeting adjourned.
You can't do anything.